Hi, this is Tammy with Keep the Beat CPR. We are going to be learning how to do adult, child, and infant CPR in this video and how to use the automatic external defibrillator. Thank you for joining us, and let's get started. We're going to first start with the adult CPR. When we recognize that a patient is down, we first want to assess the scene to make sure that scene is safe for you and me. So I'm going to assess the scene, and then I'm going to kneel down next to my patient, check for responsiveness. Hey, are you okay? If there is no response, I then want to go to the carotid pulse. I will be using the acronym CAB. C is for circulation. I also use C to remind me that I want to assess the carotid pulse. Once I assess that pulse for 5 to 10 seconds, I'm then going to move to compressions, which starts with the C as well. So C, circulation, carotid, and compressions. If I am by myself, or even if we have two people, we are going to begin with 30 compressions. We want to make sure we go at least 2 inches deep, and we want to make sure we keep our compression rate at about 100 to 120 beats per minute. Let's get started. Hey, are you okay? No response. 5 to 10 seconds, the carotid pulse, none. Now my 30 compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 22, 23, 24, 25, 26, 27, 28, 29, 30. A of CAB is airway. I'm going to gently tilt the head back. That is so that I move the tongue back into its natural position and it does not obstruct the airway. Once I've put the head back, I'm then going to deliver 2 breaths. 1, 2. I want to make sure that the chest just barely rises. After those 2 breaths, I return back to my compressions. (28, 29, 30). Breath. And I continue that for 5 cycles. After 5 cycles, I stop and reassess my patient utilizing CAB. Now, if I see an AED nearby, I'm going to run and grab it first and place that on my patient. I'm going to yell for help, and when somebody gets there, I'm going to tell them to go get me an AED and bring it back. Once they bring the AED back, I will have them doing CPR, the 30 compressions to 2 breaths, while I am putting the AED, or automatic external defibrillator, in place. My pads have pictures, and it comes with directions. What you want to do first is turn your AED on, and then follow the prompts.
Apply pads to patient's bare chest.
So I apply the pads.
Plug in pads connector next to flashing light.
I want to make sure they're tight and firm fitting, and I also want to make sure I don't cover anything up with these pads. It says now to plug it in. The person doing CPR
do not touch the patient.
Will now stop, and the AED is analyzing.
Shock advised. Charging.
I'm clear, you're clear, we're all clear.
Of patient. Deliver shock now. Press the orange button now. Shock delivered. Paused. Begin CPR.
I go back to my circulation. Do they have a pulse? No. Then C is for compressions. 30 compressions, 2 breaths. Again, I do that for 5 cycles. If there's 2 of us, We can switch when the AED gets ready to reanalyze, and it will analyze every 2 minutes. So we're doing our compressions at the rate of 100 to 120. We are going at least 2 inches deep. We want to make sure that we compress the heart to create that mechanical contraction. The AED fixes the heart to reset the electrical activity in the heart. So we want to make sure we get this AED on as soon as possible. We want to make sure we don't cover anything up with the pads. If they have a pacemaker or a Metaport, any type of patch, we'll take the patch off, we'll wipe off excess medicine, and put a new patch on. If we don't have a razor, we want to see if we have extra pads. We can take a set of pads and give that person a quick wax job so that the next pads will fit firmly in place. We should be at about 2 minutes. And again, CPR is being performed.
Stay clear of patient.
Unclear, you're clear, we're all clear.
Analyzing heart rhythm. No shock advised. Paused. If needed, begin CPR.
So no shock was advised. We go to CAB, C, carotid, circulation, 5 to 10 seconds, no carotid pulse. C now stands for compressions. 30 compressions. And 2 breaths. Breath, breath. Now, a lot of AEDs come with a pocket face mask. You can use that, or we in the healthcare, we use what's called a bag valve mask. This attaches to oxygen, fills the bag, and it delivers about 90% oxygen concentration. I place the mask over the patient's nose and mouth. I bring the head back, and with the EC3 technique, I ventilate. I want to ventilate just enough to barely see that chest rise. I don't want to overfill their lungs. That extra air will then come back up, go down into the esophagus, and we will cause gastric distension with our patient, where they will throw up. So 2 breaths, 30 compressions. 2 breaths, 30 compressions. This will conclude our adult CPR and AED and bag valve mask. The child is pretty much the same thing as an adult, with the exception of 2-person CPR. So let's do 1 person. Child is unresponsive. Hey, 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 are you okay? No response. I go to my CAB, C, carotid, 5 to 10 seconds. There's no carotid, and now my C stands for compressions. I want to do 30 compressions and 2 breaths. 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 2, 3, 4, 5, 6, 7, 8, 9, 30. A, airway, bring the head back, and B is breaths. Breath, breath. And I'll repeat this for 5 cycles. I can add the AED with this child as well. If I see it, I'll go get it before I start CPR to get it on immediately. If I don't see it, I will send somebody to find it and to bring it back to me. Everything applies to the child as it did the adult. 30 compressions, 2 breaths, 5 cycles, use the AED or reassess my patient. If there are 2 people doing CPR, the ratio then changes. Now my compression rate goes to 15 and the breaths are still 2. So as long as there's 2 people, 15 and 2, 15 and 2, stopping to reassess every 5 cycles. let's move right on into infant CPR. I assess his responsiveness, tapping him on the foot. Hey, 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 no response. I'm going to do my CAB, but C at this point stands for circulation, and the best place to assess a baby's circulation is in the brachial artery, which is in the upper side of the arm. I will assess 5 to 10 seconds. There is no pulse, so I go to compressions. I find the imaginary nipple line, place my 2 fingers on the sternum, 2 inches deep. 30. A is airway. I want to put the head into a sniffing position with this infant, not to occlude his airway, and I give very small puffs of air. Just enough to watch that chest rise. Remember, their lungs are much smaller than ours. I was taught many, many years ago to fill my cheeks with air and then deliver each breath that way. I will continue this 30 to 2 for 5 cycles, and I'll reassess. If somebody brings the AED, I can put the AED on my infant, and I'll do that by putting a pad in front and a pad on back. I'll flip him over, lay him down, plug in the AED, and I'll follow the prompts. Now, if somebody shows up and they know CPR, we can then go to 2-person CPR, remembering that now my compression to breath ratio changes. It will then be 2 breaths, 15 compressions. We have a very small body surface area here, so the best way you can do that is 1 go to the head and 1 stay at the feet. At this point, I'm going to use the encircling thumb technique, where I place my thumbs, I have my hands in back, and I administer these compressions. 8, 9, 10, 11, 12, 13, 14, 15, and the person up here delivers 2 breaths. Puff, puff. At 5 cycles, I'll go back and reassess my infant. Keep in mind, with your infant, you'll check the pulse in the brachial artery. And remember, when you check the pulse, use your fingers, not your thumb. If you use your thumb, you will detect your own heart rate. You can use the bag valve mask with the infant. It comes in an infant size. If you don't have an infant size, you could take the adult bag valve mask, flip it around, and the pointy part of the mask goes down towards the chin. And I want to deliver little small puffs, watching the chest rise ever so slowly. I go back 5 cycles, and hopefully by then 911 has arrived. So let's move right into choking while we have little baby out. If baby is responsive, mom hands you the baby you want to take. Put your hands over the baby's face, not to cover up the nose and mouth. Put their head down as much as you can. We want gravity to work in our favor, and we will administer 5 back blows. I'll flip him over. I'll look to see if it came out. Remember, we never do a blind finger sweep. The only time I can put my finger in anyone's mouth is if I see it. I don't see anything, so I'm going to deliver 5 compressions. I don't see anything. And I keep repeating this until the object comes out or baby passes out. How would I know if the object comes out and baby is responsive? You'll hear baby cry and you'll hear baby cough. If you don't hear any of those, it's safe to say that the obstruction probably hasn't been relieved or your baby's unresponsive. I look into baby's mouth after he goes unresponsive. Look for the object because the muscles tend to relax at that point. I don't see it. I go straight into CPR. 30 compressions. Look in the mouth, 2 breaths. Why do I look in the mouth before I give the 2 breaths? I'm hoping with the compressions that brought the object up. If I don't see anything, I'll give the 2 breaths and go back to the 30 compressions. If at any time I see the object, I'll go ahead, pluck it out, and assess my baby. Is he breathing? Does he have a pulse? And I will act appropriately with all the steps I've learned today.